Hello, my name is Dr. Tamara Brown, and I would like to talk to you today about a new Healthy Ageing in Scotland, or HAGGIS study for short, entitled COVID-19 Impact and Recovery Survey. I'd like to talk to you about the experiences and the lessons that we've learnt working with co-researchers. My talk today is in collaboration with Dr. Louise McCabe and also in collaboration with the rest of the HAGGIS team. So firstly, I'd like to introduce the COVID Impact and Recovery Study, but mainly I'd like to focus on the co-production activities, including recruitment and some practical examples of our methods of engagement and the learning from these. So this is Scotland's first comprehensive longitudinal study of ageing. Stirling University has partnered with Generation Scotland to extend the sample. So we have Generation Scotland participants around 6,000 plus HAGGIS pilot study participants of around 1,000. The aims of the project are to explore how the pandemic has impacted the way of people aged 50 plus living in Scotland go about living their lives and the decisions they make. We would like this research to make a significant contribution to the policy debate and the public health messaging in Scotland and in the UK. The funding for this research came from the ESRC as part of UK's RNI's rapid response to COVID-19. So how are we going to achieve these aims? Well, the survey measures COVID-19 concerns relating to the restrictions, financial worries and concerns for the future, and also vaccine attitudes. The survey explores decision making relating to visiting family and friends, attending health appointments, returning to the workplace, and our saving and spending patterns. The project team consists of social scientists, economics, a health psychologist, and community researchers. The survey themes include, as I've just previously indicated, technology and social connectedness, themes around health behaviour and health service engagement, and the theme of economic activity, including returning to work and travel. The survey itself is called COVID-19 and You, Impact and Recovery Study. And within the survey is a developed and validated scale called the Worries Emerging from the COVID-19 Pandemic, or WECP scale for short. As you can see from the flyer presented on the slide, the only requirement to join our study as a co-researcher was to be aged 50 years or over and to be living in Scotland. So, who are our co-production team? We have 7 people aged over 50 living across Scotland. They provide the lived experience, and that's a variety of experiences during the pandemic. These people come from a range of backgrounds and locations within Scotland. We meet online using Microsoft Teams, and we use email and the telephone to stay in touch, and we have managed some face-to-face interactions too. The recruitment of the co-researchers was prioritised at the start of the project. So I'm going to talk to you now about some of the examples of co-production. We have done a Think Aloud exercise to help develop the COVID fear scale. We have had a discussion with the co-researchers on the relevance of questions within the survey relating to finances and employment. The co-researchers have also reviewed the health questions and helped to develop them ready for the survey. The co-researchers have made suggestions of multiple choice answers for questions about technology use, and they have also significantly inputted on the script of the invitation text, the design of the envelope for the postal invitations, and the design of the email to distribute the survey. They even came up with the name of the survey. The co-researchers made some suggestions relating to the finance questions in the survey. They felt it was important to capture the impact of the pandemic on carers. They felt that it was confusing to link life expectancy with finance, and felt that questions relating to life expectancy were best placed in the health section of the survey. Co-researchers questioned the need to use the term life expectancy, as they felt it to be an insensitive term. Co-researchers reflected that they are all retired, and so probably not best placed to comment on the employment questions. Co-researchers also spoke about anxiety related to new banking methods and changes relating to how they manage and access money, and their fear of online scams and losing passwords. We asked the co-researchers, what would entice you to open an email or to open an envelope and answer the survey? The co-researchers came back to us with various suggestions, and these are a few that I'll read out to you now. They suggested that there be a message on the front of the envelope saying something like, would you like to be part of an important piece of research? And that the envelope should be addressed personally, not just to the household. We should mention that the research is about the pandemic and it's important and you can help. We should state clearly that it's a Stirling University study and that the envelope should be franked from the university. Perhaps the name and address on the envelope could be handwritten. In terms of opening an email, the co-researchers suggested that we link to information on the university website so the reader can see that it's not a scam. We should provide a direct link as well, but go to the Stirling website and check that we are genuine. The co-researchers suggested that we sent out an introductory email before sending the survey link, and that they would like to know in advance that they were going to receive a survey. They also suggested that the email could be individualised with the recipient's name at the top. This would be even better. We asked the co-researchers, how would they explain what the survey is about to someone who has been asked to complete it? And this is one of the quotes from our co-researchers. With restrictions gradually easing in respect of our living with COVID-19, we are all keen for a bit of normality to return. However, we also recognise that in many ways, life will never be quite the same again. So here is your opportunity to help shape the new normal over the coming months and years. We invite you to share your personal experiences during COVID and tell us what the new normal should look like. So what have we learned from co-production with our co-researchers? Well, I hope I've shown some snippets today through these slides of how truly valuable their input has been. Co-researchers have been particularly valuable in identifying key areas of concern, shaping the survey questions, and writing the recruitment scripts are really good examples of this work. Co-researchers have reported personal benefits, with the online group providing support and shared experiences throughout the pandemic. The value of co-production with people that reflect a cohort of interest should not be underestimated and should be built in to new longitudinal studies. This slide shows the co-researcher page on our new Haggis website, and I invite you all to go and have a look. If you have any more information, if you require any more information, then please contact Louise McCabe. Her email details are on this final slide. And finally, thank you very much for listening.